Imagine a genius trapped in the clutches of his own discovery. A man who would revolutionize the understanding of the human mind, but who, in his early years, was seduced and nearly destroyed by a substance he believed to be miraculous. This is the untold story of Sigmund Freud, not the revered father of psychoanalysis, but a young doctor desperate for fame, tormented by insecurity, and entangled in a toxic love affair with cocaine. An addiction that clouded his judgment, harmed his loved ones, and which, ironically, may have been the spark that ignited some of his darkest theories. The young doctor and the miracle substance. The year was 1884. Sigmund Freud, just 28 years old, was an assistant neuropathologist at the Vienna General Hospital, full of ambition but frustrated by the slow pace of his career. He desperately longed for a monumental discovery to earn him the recognition of the medical community. It was during this search that, through an article by a German military doctor, he discovered cocaine. At that time, cocaine was not an illegal narcotic, but a cutting-edge substance, a miracle product, promoted by pharmaceutical giants like Merck and Parke-Davis, who even sponsored Freud with free samples and the equivalent of $24 to endorse the product. Eager for success, Freud became his own guinea pig. In his letters to his fiancée, Martha Bernays, his enthusiasm was palpable and revealing. He wrote that he would become a wild man who has cocaine in his body, and that during a bout of depression, a small dose lifted him to the heights in a wonderful fashion. For him, it was a magical substance that turned bad days into good and good days into better ones. His fervor led him to publish his essay, Aber Coca, on coca, in 1884, a veritable song of praise to the drug. In it, he recommended it for an astonishing variety of ailments, as a stimulant, for digestive disorders, for cachexia, extreme malnutrition, asthma, and even as an aphrodisiac. But his most audacious and reckless bet was to promote it as a cure for addictions to alcohol, and crucially, to morphine. The price of deception, destroyed friendships, and the ghost of guilt Freud's faith in cocaine did not remain in the laboratory. He began prescribing it to his family, friends, and patients, becoming an evangelist for the substance. The most tragic case was that of his close friend and colleague, the physiologist Ernst von Fleischl-Marxow. Fleischl suffered from debilitating chronic pain and had developed a severe addiction to the morphine he used to manage it. Convinced of cocaine's curative properties, Freud strongly recommended he use it to overcome his morphine addiction. Initially, the treatment seemed to work, but it soon proved to be a catastrophic error. Fleischl was not cured. He simply traded one addiction for another, and a far more destructive one. He soon was consuming more than a gram of cocaine per day, developing a cocaine-induced psychosis that led him to suffer terrifying hallucinations, such as feeling white ants crawling under his skin. His health deteriorated rapidly, and he died in 1891 at age 45, with Freud forever bearing the weight of having accelerated his friend's death. Although Freud tried to defend himself, the Fleischl tragedy marked the beginning of his disillusionment with the substance he once idolized. Cocaine's shadow on the birth of psychoanalysis. Despite growing evidence against it, Freud continued using cocaine regularly until around 1896. His consumption was such that his nose was chronically congested, requiring surgery to breathe properly, and he suffered from heart palpitations and depression. Medical historians like Howard Markle note that by 1895, Freud was using so much cocaine that he experienced chest pain. It is impossible to ignore the influence of this experience on the development of his theories. Freud himself recognized that cocaine had a peculiar power to unleash the tongue and make him talk endlessly about things he thought were locked away in his brain. Doesn't this sound like the central mechanism of free association, the fundamental technique of psychoanalysis, where the patient verbalizes without filter everything that comes to mind? Some scholars suggest that the talking cure therapy may have been inspired, at least in part, by these states of cocaine-induced logorrhea. His masterpiece, The interpretation of dreams, written in 1899, is also imbued with this influence. Historian Howard Markle states that the model dream analyzed in the book is, in fact, a cocaine-using dream, the kind of vivid dream experienced by addicts. Freud's own theory of dreams, as the hallucinatory fulfillment of repressed desires, finds an unsettling parallel with the artificial euphoria, immediate satisfaction provided by the drug. Legacy of a narcissistic wound. Freud finally quit cocaine around 1896, following his father's death, and after nearly killing a patient, Irma, during a botched procedure performed with his colleague Wilhelm Fleischl, who was also a cocaine enthusiast. He later referred to this period as a distraction he was anxious to conclude. However, the impact was profound and indelible. This toxic love story was in reality a narcissistic wound for the young Freud. It promised him fame, but brought him disrepute. It promised him control, but plunged him into the chaos of addiction and guilt. This first-hand experience with an uncontrollable internal force, an impulse that led him to self-destruct despite his intellect, may well have been the crucible where he forged his understanding of unconscious drives, repression, and the eternal struggle between the pleasure principle and the reality principle. Cocaine showed Freud that the ego was not, as he himself would later say, a master in its own house. It was a painful lesson, learned in the trenches of his own psyche, that would forever change the way humans see themselves. The final question hangs in the air. Was it necessary for the genius to poison himself to discover the secrets of poisoned desire?